Now, if you have managed to reach age 30 without experiencing some form of hair loss, then congratulations, because you have avoided the advanced hair loss category. But reaching 40 years old without any hair loss is an even tougher challenge. I would say that 30-something-year-olds are the most common age group to enter my hair loss clinic. And let's say if we were to take the example of a 35-year-old gentleman who comes in at Norwood 3. Norwood 3 at age 35 is not particularly aggressive hair loss, and depending on his family history, of course, which we would get into, he would likely go up the Norwood scale by a point every 10 years. So for example, by age 45, he might be a Norwood 4. And this is a very common hair loss pattern that I see. So for this patient, I first ask him if progressing from a Norwood 3 to a Norwood 4 bothers him. And if the answer is yes, then finasteride 1 milligram per day is best to stop this. The second question I ask him is, if your hair loss stopped now, would you be bothered about your current hairline? And if the answer is yes, then a hair transplant of, say, 2,000 grafts might be indicated. Let's say the patient has now decided he wants a hair transplant. My third question will be, do you want to go for strip FUT surgery and have access to roughly 3,000 extra grafts over your lifetime, but have a 2 millimeter wide linear scar, or choose the FUE technique and avoid the linear scar, but have access to fewer grafts over your lifetime? Now, with either procedure, a good result can be obtained, and that is exactly what this patient of mine achieved here. You can see here, this is a patient in his 30s who came to us with that classical hairline recession. And we were able to rebuild the frontal third with a conservative yet dense hair transplant. This particular patient opted for a combo procedure of both strip FUT and FUE. And I'm really glad we were able to create a nice natural hairline that then built in density as it went back. This patient is in an excellent scenario now because he has opted for an age-appropriate hairline that will age very well and not put him in a bad situation where he needs to cover a very large surface area with not enough grafts to fill. Interestingly, this particular patient opted to avoid medications because he did not want the potential side effects. So it's likely that his hair loss will progress, but because he's opted for FUT surgery, he can now trust that he has more grafts in the tank over his lifetime to use, given his high risk of future loss. So I hope this was helpful for anyone aged 30 to 40 experiencing hair loss. We always use a mixed approach of medications and surgery to manage hair loss. If you're interested in a hair loss consultation where we can get into your current hair loss medications, as well as whether you'd be a candidate for hair transplant surgery, shoot us an email at info@parisismedical.com if you'd like my help.